Hello everyone, welcome to my channel. So today we are going to be talking of societal perception or wife's perception once their spouse say they are going into permanent family planning named vasectomy. We have been privileged as counselors to see several negative reactions from wives and of course the society at large once a man says he is going to have a vasectomy done on him. This is Royal Care Counseling Outreach. And my name is Rachel. I still remain your online counselor. If you are new here, please do not forget to join the family by clicking the subscribe button and the notification button. And don't forget to follow us on all our social media platforms. And please watch our previous videos so that you can be conversant with what we are talking about. So let's go back to today's topic, vasectomy. Before we go into details of vasectomy, let's first define what vasectomy means. Vasectomy can be defined as a surgical procedure for male sterilization and a permanent method for birth control. It's a permanent method for birth control, meaning once you have done it, you have done it. There's no turning back. So let's talk about how vasectomy came into existence. Vasectomy came into existence in the year 1823. It was first tested or done on dog by a man named Cooper in England. Then after a while, another person tested it on human in India in the year 1924. That's when it was first tested on the first human. However, here are some things to take note of when considering going into having a vasectomy done on you. Number one is that it's a permanent procedure. So there's nothing like, okay, I'm tired of it, I want to start reproducing. No, once you have done it, you have done it. Then number two is that it is greater than 90% accurate as a family planning technique. Number three is that it's a surgical procedure, meaning admission is required. You are going to be hospitalized for some hours, for some required hours. So it's not something you just do and immediately after the surgery you just pick up your bag like other female family planning that you leave. You are going to stay there for some time. It is a surgical procedure, so it requires you sitting down there for some time. Here are some false myths about vasectomy, that is the negative things or people's perception towards vasectomy. Number one of those false myths is that men believe it prevents, or probably the society believe it prevents from HIV and STDs. Vasectomy is a family planning technique, not to prevent hormones and some virus from attacking you. No, or not to prevent some hormones from functioning. No, it is just a family planning technique. It does not prevent against STDs and HIV. So that's a wrong perception of vasectomy. Number two of such perception is that they believe once a man does vasectomy, it makes the man automatically becomes impotent. No, vasectomy cannot make a man becomes impotent because it is just the removal of the seminal fluid from the semen so that reproduction does not occur. So it cannot make a man go impotent. The man is still going to be sexually erect, is still going to be able to ejaculate. So it does not make a man impotent. So that's a wrong false myth to assume. Then number three of such perception is that it is believed that vasectomy makes a man promiscuous. That is, the man believes, after all, I cannot get somebody pregnant. So since I can't get somebody pregnant, I am at liberty to frolic with several women as I wish or as I like. No, that's another wrong perception to assume. So let's go into some social issues of vasectomy. After vasectomy, pregnancy might occur. So number one of what you should look at is, number one, failure to use other family planning techniques such as protection like condom can make pregnancy occur, because once you just go into the procedure of surgery, you have to be sure that you have 0% of sperm in the seminal fluid. That is, you in most cases, you have to ejaculate 10 to 20 times to be sure that there's 0 count of sperm in your seminal fluid. Number 2 is that one must confirm 0% sperm count on 2 different occasions before starting unprotected sex. Meaning, if you want to start unprotected sex or you want to start having unprotected sexual intercourse, you must confirm like 2 to several others that your sperm count is 0. Number 3 is that recanalization is possible after several years. Meaning, those tubes that have been detached during the surgery can reconnect itself after several years. However, it is on rare occasion. It doesn't occur constantly. It's very rare, as in it has very slim chances, but it can reoccur. So those are the social issues that might lead you into impregnating a woman even after undergoing vasectomy. As a counselor, I've been able to see several perceptions or several thoughts on vasectomy, especially coming from their spouse, that's the wives. They have several negative perceptions towards vasectomy, even the society at large. Number 1 of such perception is religion. They believe the Lord or God says we should go ye into the world and multiply. However, wisdom is profitable to man. You don't just multiply into the world. You don't just go into the world and just keep reproducing without being able to cater for them. Once you keep giving birth to offsprings that you cannot cater for, you are giving birth to societal nuisance, and they are not going to be of good benefit to you as an individual, because once you reproduce what you cannot cater for, you cannot take care of, they become a burden to you. Number 2 is that they believe once a man does vasectomy, that masculine nature in him is off. It's no longer man enough. However, that's a wrong perception, because the man can still ejaculate, he can still get erect, he can still be sexually active. The only difference is that there is no sperm in his seminal fluid, meaning that XY chromosomes, he can no longer ejaculate it into you for you to reproduce, for you to combine it with your XX chromosomes to be able to reproduce. That is the only disadvantage. But any other perception is a very wrong one, because ejaculation can still occur. And the third reason why wives frown against vasectomy is that they believe it gives room for promiscuous men. That is, their men become promiscuous. They believe, after all, I can't get any woman pregnant, so they just tend to start having sexual intercourse with any kind of woman they see. So they believe their men become vulnerable. And number 4 reasons why women shy away from vasectomy is because they believe in a society where men are the head, women are supposed to be the ones to go for the family planning and not the other way around. So they put it on themselves that they should undergo the family planning, not the man, because he is the head in an African. As a counselor, here are some reasons why we encourage vasectomy. Number 1, it helps the woman to relax, or the women, to relax, because the women go through all those rigorous visitation of the hospitals because they want family planning. Sometimes they have to go to the hospital 3 times in a year, sometimes twice a year. Sometimes they go to remove and re-put, collect injections, so it reduces all those rigorous stress in them. So that's why we as counselors, we encourage vasectomy. Number 2 of the reasons why we as counselors encourage vasectomy is those hormonal changes in women after childbirth or after receiving those birth control pills or taking those birth control procedures gets to their hormones, which leads some of them to become obese. Some of them, their hormones become imbalanced. They don't get them themselves anymore. Some of them, I've met with a client that said ever since she did family planning, she normally have this burning breath inside of her. She's always sweaty, she's always hot. That's another disadvantage of the family planning she did. Probably she did not check the one that best suits her body. Number 3 of such is that it helps women from undergoing that stress of checking the family planning that best suits their body, and at the end of the day they still end up picking the wrong one that does not suit their body. So it helps women in that angle. Number 4 is that it is cheaper. Vasectomy is cheaper, it's less stressful for the women, and it's cheaper for the women. That's why I said it's cheaper. It's cheaper for the women and it's less stressful for the women. So now let's look at reasons why counselors discourage vasectomy. One of the reasons why counselors discourage vasectomy is because, number 1, some clients are not patient. Immediately after undergoing the surgical procedures for vasectomy, they just want to start having unprotected sex. They don't want to be sure that they have 0 or no sperm count in them. So they have to have protected sex for a while, and after like 10 to 20 ejaculation has occurred, then they still have to test like 2 to 3 times that there's 0% of sperm in them before they start having unprotected sex. But some clients are not patient, so immediately they have the vasectomy done, they want to start having unprotected sex. So once it results into them ejaculating into the woman and the woman reproduces, they say, oh, I did a very wrong thing, which is not so. So most cases, counselors try to divert clients' attention, especially when the counselor has observed that the client is not the patient type. Try to divert the client's attention from vasectomy. Number 2 of such reason is that it is a modifiable risk factor for prostate cancer. Meaning the prostate gland is exposed to prostate cancer, so it's a modifiable risk factor. So most counselors, once they know that you have the genetic trait of having prostate cancer, they try to remove your mind from, or they try to discourage you from going into vasectomy. One of the reasons why counselors discourage vasectomy is because of some clients' genetic predisposition to prostate cancer, which can be contraindication to vasectomy. Meaning, probably it has been observed that, okay, in the person's family history or genetic trait, somebody in his family has prostate cancer, has ovarian cancer, cervical cancer, breast cancer. So once the counselor has observed that, okay, 1 person, 2, 3 has been diagnosed of cancer in the client's family, the counselor is going to decline. The counselor is not going to be in support of vasectomy. The counselor is going to frown at it, or the counselor is going to try to discourage the client against vasectomy. So as a counselor, I will advise, before going into any family planning, you check which suits you. And for the male gender, before going into vasectomy, please see your counselor so that your counselor can talk to you, can enlighten you more, and see your health worker so that your health worker can guide you. And after carrying out the surgical procedure of vasectomy, please try to be patient. Be sure that your sperm count is of 0% before having unprotected sex with anybody, and check your genetic predisposition before going to carry out a vasectomy. That's why I said make sure you see your counselor. And we are available for any counseling section of your choice. Please do not forget to book a counseling section with Royal Care Counseling Outreach. I still remain Rachel. Bye bye.